Hello everyone, welcome to HIM 225. This is the beginning of a series of lectures covering Chapter 14 in your textbook, which is Mental, Behavioral, and Neurodevelopmental Disorders. As always, I'd like to recommend that you read the chapter. Be sure to look at those abbreviations and acronyms at the beginning of the chapter, the glossary definitions at the end of the chapter, and then I suggest that you take a look at the chapter review and workbook assignments just so you're familiar with what the homework is that you'll be doing for this particular chapter. This is Chapter 5 in ICD-10, and as you can see on the screen, I've gone to the integrated code book and I'm looking at Chapter 5. And this is a chapter that includes DSM codes that are used for psychiatric coding. This includes the psychiatric diagnoses. It includes abuse and dependence codes, intellectual disabilities. It includes all of those types of codes. Now, you'll notice that we really don't have very many guidelines for this chapter. There is a guideline in the 2021 guidelines that's not included in your book, and I'm going to show you that in just a minute, and we'll go over that. But to start off with, the first guideline tells us that when a patient has a pain disorder that is related to psychological factors, that the code we assign is F45.41. And in the index, if I put in pain and then start to type psychologic, it'll take me to psychogenic, F45.41. I can verify that in the tabular, and I can see very clearly that that code is here. We do have an excludes one note that applies to the code F45.41. The pain, any code that relates to a pain in the body that is physiologic cannot be coded with this psychological factor code. But I also want you to notice right underneath that F45.42, this is the code that we use if a patient has a pain disorder and that there is a psychological component as well. So it means that, yes, the provider believes that they do have pain, but they also have a psychological component as well. And you'll notice that there is a code also note here. It tells you to code also the associated acute or chronic pain. So you have to have both codes. You have to have the F45.42 that tells you that there's a pain disorder, and there's also a psychological component. So if we look at this first example, this is a patient who's receiving behavioral therapy for treatment of chronic pain syndrome with an associated psychological factor. So if we were here in pain, and if we do chronic, we can see that there is a subterm here associated with significant psychosocial dysfunction. And that code is G89.4. So let's take a look at that code. Oh, my internet's been messing up and I'm afraid it's gone out. I hope I don't lose this recording. Alrighty, I had to take a brief break there because my internet went out. Our lines are being replaced and it's very frustrating. So anyway, I believe that we were talking about the first example on page 312 in your textbook. And this is an example of a patient who has chronic pain syndrome as well as pain-associated psychological factors. And in the index, if we go to pain, chronic associated with psychosocial dysfunction, we'll see that code G89.4, which you see here in the tabular. And it tells you that, when you look at this, it tells you that this is, see if I can get this to go up, chronic pain associated with psychosocial dysfunction. So we know that G89.4 is the appropriate code for that. If we go to pain, psychosocial, we see that F45.41 code, but That is not the code. If we go to that in the tabular, you'll see immediately by looking at the description of this that it is exclusive and that you need to use the code F45.42 for these types of patients. And this is a guideline that you need to be familiar with, and you need to be familiar with these codes. Now, the next guideline that we have is an in remission code. So if we have codes, conditions that are documented as in remission, and they're in this range of codes of F10 to F19, in order to apply that in remission code, we do need to have documentation of the provider's clinical judgment. So the codes for in remission are assigned only on the basis of that provider documentation, unless the classification system tells you to do otherwise. And what this guideline tells us is that if we have mild substance use disorders in early or sustained remission, they're classified to the appropriate codes for substance abuse in remission. But if we have moderate or severe substance use disorders that are in early or sustained remission, those are classified to substance dependence in remission. So the difference in these is, are we coding it to an abuse in remission, or are we coding it to a dependence in remission? And that depends on the provider documentation and the fact of whether or not it was a mild substance use disorder or if it was a moderate or severe substance use disorder. Now I want us to look at these codes in the tabular. So if we look at these codes, F10 through F19, we can see the categories here are related to alcohol, opioids, cannabis, cocaine, nicotine is included here as well. If I look at the alcohol-related disorders, you can see that we have a code here, alcohol abuse in remission. If we go on down, we will see that we have a code for alcohol dependence in remission. And so again, these in remission codes are assigned based on the physician's documentation. If I go to dependence, alcohol with remission in the index, it sends me to code F10.21. It sends me to alcohol dependence in remission. If I go to abuse, alcohol with in remission, and here you see it says early and sustained, it sends us to F10.11, alcohol abuse in remission. And we'll see that consistently with these codes that are under abuse and then under dependence. For instance, if I go to abuse, well, I have to be able to type. So if I go to abuse, drug, cocaine, I can see that there is a subterm for in remission, F14.11, cocaine abuse in remission. If I go to dependence, drug, cocaine, in remission, F14.21. So basically, this guideline is telling you that to apply these in remission codes, you need physician documentation and the determination of whether or not to code it as an abuse in remission or a dependence in remission just depends on the severity. And you may have to query the physician to make that determination. Now, I also want to show you that if I go to, so let's say that a physician documents that a patient has a personal history of alcoholism, but that they have been sober for 10 years. In the index, if I put in alcoholism, you'll see that it includes this code without remission. So be very careful with that. But the code for remission, F10.21, and actually if we go and verify that code, alcohol dependence in remission. The other thing I want to show you is if you go to history and then personal, and then you'll see where it says here alcohol dependence. Again, it sends you to the same code, F10.21. So that's usually the most common thing that you will see. For other drugs, you can do history of drug dependence. And you see I've gone to history, personal, and then drug dependence. It tells you to see dependence, drug by type in remission. So it very specifically sends you back to the to dependence in the index, and then you need to go dependence drug and then choose the drug. So there would be cannabis, there would be cocaine, and for each of them you'll see in remission. So let's look at this particular example that we have. Patient has a history of alcohol dependence, currently in remission, and we're right here in this category, and we looked at this earlier, dependence, alcohol with remission, F10.21. So your question for this lecture is to go to exercise 14.2. Go to exercise 14.2. And I want you to answer question number 7. So in this particular question, you have a person who is cocaine dependent, but they are abusing marijuana. So obviously you're going to have two different codes. You're going to have a code for cocaine dependence and a code for marijuana abuse. And that will conclude this first lecture for Chapter 14.